Welcome to the JBI Evidence Implementation podcast series. I am Dr. Vanessa Abacan, a board-certified pediatric clinical nurse specialist with a diverse background in maternal and newborn nursing and patient safety. I've been a nurse for 10 years and a year of being an advanced practice registered nurse as a CNS. I currently work as a women and children clinical nurse specialist at the University of Texas Medical Branch Health System. Now, before I dive into this review, I would like to thank JBI for this opportunity to provide a commentary on the article titled Improving Communication Among Nursing Staff at a Children's Hospital in the Southern United States, a Best Practice Implementation Project. Now, in this video, I will discuss key findings and some insights that I gleaned as I was reading this article. I'll also highlight implications for nursing practice and areas of opportunities. So this project was structured using the JBI Evidence Implementation Framework and utilizes the JBI practice application of clinical evidence system and getting research into practice strategies for translation and implementation. So let's talk a little bit about communication, since this is the central focus of this article. The authors address the fact that breakdown in communication is a leading cause of errors that result in adverse patient outcomes. In the healthcare setting, having a clear line of communication among team members is crucial. So there are multiple options teams can choose as communication tools and strategies. In my organization, in the NICU in particular, my team uses an evidence-based huddle board that guides their pre-shift huddles. The board includes staff members in-house, such as milk tech, lactation, respiratory, interpreter, etc. They all include critical updates related to EPIC, supplies, ongoing initiatives, safety issues, and resolutions, etc. It's a great way to keep everyone in the loop and to also just disseminate important information. The authors discussed that in their unit, they use a visual management board. However, a gap they found was the location was suboptimal. So part of their strategy that they outline in their GRIP analysis was to identify a more practical location for their visual management board. Now, the Agency for Healthcare Research and Quality, or AHRQ, developed Team Steps, which is an evidence-based set of teamwork tools that's aimed at optimizing patient outcomes by improving communication and teamwork among healthcare teams. This includes patients and family caregivers as well. This program discusses various communication tools, including SBAR. This article mentions their use of a visual management board being their primary communication tool. Now, to start their project, the authors created an audit tool to establish baseline practice and identify gaps to be addressed by their interventions. The audit criteria that they looked at was the healthcare team's training on communication skills, teamwork and conflict resolution, using a structured communication tool, or if the team has dedicated times for team briefings or face-to-face open dialogues. However, one limitation of this project was the nature of the audit survey, being that it was self-reporting. So based on this, it's important to note that potential for recall bias and perhaps even Hawthorne's effect, since they were privy to the intervention involved in this project and what is being observed. One way to reduce this is, if one were to replicate this project, is to explore the possibility of pulling the data or roster for those training sessions to ascertain attendance and education. In light of this topic of communication and what we have discussed, there's also that notion that I thought about as I read this article and further reflected upon personally. And one part of communication is emotional intelligence and empathy. So one of the goals of emotional intelligence is to cultivate a positive work environment. And as the authors mention in this article, adequate communication skills foster respectful and positive relationships, resolve conflicts, and inspire others. So it goes hand in hand with effective communication, right? Imagine this. You can have a whole curriculum and rigorous training on SFAR or AIDIT or IPASS and all other mnemonics that can help structure communication for various situations. But without emotional intelligence, this will be ineffective. There are many types of communication, not just verbal. Nonverbal cues and active listening are part of effective communication and being emotionally intelligent. In my organization, there is an emotional intelligence training open for all employees that is offered quarterly, which perpetuates that culture of positivity. One area of improvement that this project can further explore will be tying in outcome measures to actual quality metrics, such as nurse-sensitive indicators or patient-sensitive indicators. Another thing I recommend is to look through the AHRQ website. There are various tools that are ready for use to serve as instruments to conduct an audit, such as Team Steps Readiness Assessment Form or the TTACT, aka Team Steps Teamwork Attitudes Questionnaire, and even a team performance evaluation tool, which will be great for empirical data collection involving an observer, rating adherence to learned elements such as team structure, communication, leadership, and situation monitoring. Overall, I commend the authors for doing a great job in organizing this project and demonstrating improved nursing staff communication as a result of this project. Communication is essential, and it's also important to be mindful of the other elements that goes hand in hand with communication, such as emotional intelligence and empathy. Thank you so much for listening.